And it's important to also remember that, around about 60% of our pharmaceutical medicines are also derived from plants.
Yeah.
So plants have, lots of chemicals in them that really work very well in the human body. And, we've got our ancestors to thank for all the wonderful experiments that they did with all different types of plants and plant medicines and foods, and they worked out over millennia, don't go and eat some foxgloves because you might die, but if you take some hawthorn, it might be good for your heart. That's the great thing about being a herbalist in the 21st century, is that you've got a whole body of scientific research plus traditional knowledge to draw together as a resource. And I think that's what a lot of women really struggle with at that time, as well as lots of other a lot of other changes, big changes that are going on in their lives. But yeah, it can be a time of loss, but I think it can also be a time of great gain as well. Do you want to feel healthy, or do you want to keep carrying on with these same patterns that might not be serving you? Because, women are not just menopausal women, they come with so many other things going on. They might have lots of other health conditions that they want to sort out as well. They might have eating patterns they want to, get on top of. They might want to, lots of women really start doing lots of exercise in their 50s and just feel great,
Yeah, I do a lot more exercise now than I used to, but that's because I didn't used to need to.
Yeah, we have to look after ourselves so much more. And I think that's a huge life lesson that we don't get taught as young women. We don't get taught how to look after ourselves properly.
Hello, everyone, and welcome to How to Have Extraordinary Relationships podcast. We are broadening the net far and wide. We're talking to lots of different people about lots of different things. And today I'm delighted to be with Melinda McDougall, who is a medical herbalist. She's a women's health expert. And I met Melinda because Clover Stroud, who is episode 1, season 1 of How to Have Extraordinary Relationships podcast, recommended her to me. And she is an excellently brilliant person. And I really wanted to invite her onto the podcast to talk about her work, how she supports women, and how it all works. So welcome.
Oh, thanks so much, Lucy. It's wonderful to be here with you and all of your lovely listeners.
So tell us about being a medical herbalist. Can you, that's a huge topic of conversation, but just tell us all about that. Well, how do you, how did you get into it and what do you do?
Yeah, so a medical herbalist is someone who has been through an enormous amount of training. So it is very much like studying to be a doctor. So I've been through an intensive medical training. So I've studied all the things that a GP would study, from anatomy, physiology, pharmacology, and really learning about how the body works. But then the most exciting bit is that there's a whole extra layer of knowledge that we study and learn about, which is how to use plant medicines. And these are herbal medicines and plant medicines. And it's the oldest form of medicine on earth. We as a species would not be here today if it wasn't for plant medicines. And it's important to also remember that, around about 60% of our pharmaceutical medicines are also derived from plants.
Yeah.
So plants have, lots of chemicals in them that really work very well in the human body. And, we've got our ancestors to thank for all the wonderful experiments that they did with all different types of plants and plant medicines and foods, and they worked out over millennia, don't go and eat some foxgloves because you might die, but if you take some hawthorn, it might be good for your heart.
Yes. So it's a huge subject, isn't it? So, what got you interested in it? Well, because obviously, as you've said, I've looked into studying herbal medicine for all sorts of reasons, and it's huge. It takes years and years and years. It is not. People think it's someone going out and mashing up a bit of, mallow, and it's not that, is it?
Yes.
It's a huge
No.
subject.
Yeah, it's huge. So I always say that herbal medicine can be really simple and it can also be really complicated. So it can be as simple as having a cup of chamomile tea, which is what we're all very familiar with, or a cup of mint tea. And that definitely has a physiological effect on our body. You could even say that having a cup of coffee is a herbal tea,
Mm,
herbal medicine. Or it can be very complicated. So, I work a lot with women going through breast cancer treatment, for example, and just knowing about, herb drug interactions and what's safe to take and what's not safe to take, that can get you into a very complicated scientific realm.
mm,
Um, so yes, it can be a very complicated topic. And as to how did I get into it, so came to it sort of halfway through my life, sort of in my 30s, and I grew up in Australia
mm.
where natural medicine, I think, is much more normalized than it is
Okay.
potentially in the UK.
Mm,
Although, in Europe, so in France, Germany, Austria, places like that, it's also much more normalized. UK, for some reason, thinks herbal medicine's a bit strange, but it's, you know, the most common form of medicine used worldwide. Um, and actually, the UK has a hugely rich tradition of using herbal medicines and,
mm,
apothecaries in the 17th and 18th
mm,
centuries.
mm.
And actually, the history of medicine is the history of herbal medicine. So I was actually very lucky to study it in this country because it does have such a rich heritage. And I used to work in the media. I used to be a documentary maker for Channel 4 and BBC.
Okay.
And yeah, and I was sort of in my late 30s and I could feel myself burning out a bit and I could
Mm,
see that the writing was on the wall for TV. And I really had a long, hard think. And I've always been so passionate about women's health. And
mm.
at the time, I could see this huge gap in menopause care.
Yes.
So this is way before anyone started talking about it. And I know I always have known how effective herbal medicine can be for menopause. So
Mm,
that was actually the reason I changed my career and signed up to years of study and then got a Master of Science degree in herbal medicine. And now I work in women's health. So I was,
yeah.
I have no regrets. It was a good move.
Okay, so there's quite a lot to unpick, isn't there? So number one is the statement, interesting statement that the UK generally is a little bit more backwards or a little bit more, I don't know, skeptical behind when it comes to accepting the efficacy of herbal medicine.
Hmm, can be. It can be. I mean, I'm talking more about the medical establishment, I would say. There are some very open-minded doctors in this country, and I work with lots of them and oncology teams and people like that. But in Germany and France, doctors are actually really trained in herbal medicines and prescribe them to their patients really commonly. Yeah, so like in Germany, something like St. John's wort would be first line treatment for depression rather than giving
Wow,
someone antidepressants. Yeah, so
I didn't
it's,
know that. So rather than going to Boots and thinking, well, I don't really know which, I mean, because I'm sure you will tell us all that there's all sorts of grades of things. So I don't
yeah.
know which one of St. John's wort I should get.
Well, there's lots of different, makes of supplements out there, but in Germany, they will have a standardized extract of St. John's wort that doctors will prescribe. They also prescribe things like red clover for their menopause patients as well. So Germany actually has had a standardized botanical extract treatment for menopause since the 60s. So, so UK is catching up, but I think we've been a little bit more cautious, a bit more reticent here in terms of doctors and prescribing and the medical establishment, and there can be there's a perception that herbal medicine is not scientific, which,
Yes, there is
just
that.
isn't true.
Okay,
Yeah.
that isn't true.
No, there's a lot of science and research, and you have to take into account hundreds and hundreds of years of human experimentation as well, which is also science,
Mm.
as well as, there are clinical trials out there that have been done on many, many different types of herbs. So, that's the great thing about being a herbalist in the 21st century is that you've got a whole body of scientific research plus traditional knowledge to draw together as a resource.
Yeah. When I was little and I would be ill, my granny would go off into the woods or the fields and come back with stuff and make tinctures out of
Brilliant.
whatever. Yeah, I mean, and then she had a Culpeper herbal that I have from her with all her,
Yeah, fantastic.
yeah. And then we kind of went away from that, didn't we? That was considered to be, I mean, if I said, right, I'm going to go off into the woods and find some whatever and turn it into, I mean, people would think I'd gone a bit mad.
Well, I mean, this is the interesting point that you raise because it is, only as recently as our grandparents' generation that this was common knowledge
Yes,
and commonly used.
yes.
And just over the last sort of, maybe like 80 years, I feel like we've really drifted away from that and we've swung really towards the pharmaceutical path. And
Mm.
obviously, pharmaceutical medicines completely have their place. Um, but I think the pendulum is starting to swing back a bit into the middle again because people really recognize that there's a lot of benefits to taking natural medicine and to have to reclaim some of that knowledge that we've lost because it's very empowering to
Mm.
know that you could go down the road into your local hedgerows or fields or forest and know exactly which plants to pick and which ones might do what, and then be
Mm.
able to take them home and use them. And your grandmother knew what to do, and that's not that
Yeah,
long
she
ago.
did. She made tinctures, she used alcohol. I don't know what she did, but she would busy away with pestles and mortars and stuff like that. And then she'd appear at some point with some tinctures and say, take that. So I didn't even go to the doctor as a child. I barely
There you
ever
go.
went to the doctor, in fact.
Well, there you go. So yeah, it's not that long ago. It's only, two generations ago. But I think it's interesting. I think women particularly have a real affinity with herbal medicine, natural medicine. It's always been that sort of archetype of the wise woman in the village who knew what to do with the plants and looked after herself and her community and her family.
Yeah.
And I think women are really reconnecting with natural medicine in a huge way.
What's better? I mean, better about it. I mean, why do what? Does it have less side effects? What? This sounds a bit of a silly question, but what's the difference between a natural medicine and a pharma medicine? I mean, I know that the aspirin is essentially willow.
Yeah, so that's a really good example. So willow bark has the same types of analgesic properties that aspirin does. Um, but if you think about aspirin, we know that taking aspirin long term really has bad side effects on your gut lining and
Mm.
can really inflame your gut lining and cause ulcers. And that's because we've isolated one chemical from the willow, salicylate, and we've put that into a synthetic drug.
Mm.
Whereas when you're taking herbal medicines, you're taking a whole plant medicine, and that has many different chemicals that actually work together. So with the willow, you've actually got chemicals in that plant that protect your gut lining. So you've got tannins in there that protect your gut lining.
Mm.
So you're not going to get those side effects by just isolating the salicylic acid that comes out of willow. So
Really?
that's just an example.
Yeah, yeah, it's so fascinating. So it's a huge thing for you to learn.
Yeah, absolutely.
Sit there with, let's say, a peppers, and a peppers herbal guide is huge, and that isn't even all of them. And you're learning. I mean, when you started learning, did you think, what am I doing?
There were definitely some moments of feeling very, very overwhelmed and thinking, how on earth am I going to absorb all this information?
Mm,
But the great thing about learning herbal medicine and working with plant medicines is that it's not just about looking at books. You get to taste the plants, you get to smell the plants, you get to see
mm.
them growing, you get to work with them, you get to make medicines from them, you get to take them yourself and feel how they're working in your own body. And then when you start working with patients, you really start to see how different herbs, make people feel and what results you can expect from different herbs. So you start to become very familiar with these plants, the more you use them.
And do you grow a medicinal garden, or do you have to source your plants from elsewhere?
Yeah, so I have an allotment,
Mm.
but it is just a small allotment, and I grow some of my own plants. I go foraging,
Mm.
for plants that might grow in the wild, like nettle or hawthorn berries or elderberries. I always get a harvest of every
And
single
what
autumn.
what are elderberries good for?
So elderberries is my top plant that I must get a crop of every year, because they are very high in vitamin C and they're also incredibly antioxidant, and they're perfect for getting you through the winter. So I make a syrup out of the elderberries
Yeah.
and it protects your immune system. And I've really tested this all through COVID as well with lots of patients. And there's actually been an NHS trial done looking at elderberry and COVID symptoms and reduction of uh, time and severity of symptoms. So I would not be without my elderberry going through the winter because
Okay. You pick your elderberries because there's loads of them around, and then you turn them into a syrup.
Mhm.
But you're putting a lot of sugar in that, right?
There can be a lot of sugar. You can also use honey as well. You can use
Okay.
raw honey.
Agave or something.
Yeah, and I usually throw in lots of other things like ginger and cloves and cardamom and cinnamon and yeah, just lemon as well. I put some of that in there.
Oh, yummy.
It's really delicious, actually.
And do you sell that to your patients? Like,
Yes,
okay,
yes.
well, I'm going to sign up for one of those. Um, yes. So when people find you,
Mm,
what are they coming to you for? What are most people? What are women coming to you for? Are they coming to you because of menopause, COVID, or lots of
mm.
symptoms?
So it's pretty broad ranging. I mean, there's lots of medical herbalists in the UK, and you can go and see a medical herbalist about most health conditions, if not
Okay.
all health conditions, right? But because I love working with women's health, I mainly work with, well, women of all ages, but ranging from younger women who have period pains, heavy bleeding, PCOS, endometriosis,
Mm,
they might have infertility, and then moving up to midlife, which is where I really hone in and specialize in supporting all women going through menopause. So you know whether they've had surgical menopause, so they might have had a hysterectomy,
mm,
um, chemical menopause, they've been, their bodies have been pushed into menopause through breast cancer treatment, for
mm.
example, or women who just prefer to go through a natural menopause, want a bit of support. Or there are women, I do have lots of clients who take HRT, but they still have lots of niggling symptoms that they want to get on top of.
So people have what they you have a consultation, don't you? That's how you work.
Yeah, so I normally recommend a 3-month piece of work. So an initial consultation and then two follow-up consultations over the 3 months. And then um, I will formulate a herbal medicine prescription that is tailored to someone's individual needs
Mm.
and then send that out to them after the first consultation.
So people come and say, "Well, I'm feeling sleepless. I have anxiety. I've got hot flushes." That would be
Yeah, all of
symptoms.
Yeah, totally. So, all the menopause symptoms that you can imagine, I've heard it all and, I've heard some, yeah, quite extreme cases as well. And don't forget also the perimenopause can be such a roller coaster as well. So you might get,
Yeah.
heavy bleeding and erratic cycles and, that can often be the most sort of tumultuous time as well. So yeah, there's lots of good herbal remedies to help with all of that.
So the idea behind it is that it helps with the symptoms or because some people say this, right? They say it's mind over matter. So if someone gives you a pill that's made of talcum powder and tells you, well, I'm only saying talc, and tells you that this is a magical pill that's going to cure your back pain, it cures your back pain. So some people say,
Hmm.
"Oh, it's all stuff and nonsense. It's the power of your mind that's telling you that now you're taking whatever, you're going to be better."
Yeah, I mean, I think I have enough patients that come to me as skeptics who probably wouldn't be swayed by me telling them that X is going to do Y. I think there's also lots and lots of scientific studies that look at how these herbs work in the body,
Okay.
so that we know that, for example, some herbs work as estrogen modulating herbs and that they sit on our estrogen receptors. There are other herbs that work on neurotransmitter pathways. There's all different mechanisms of the ways that these plants work in our bodies. So, sure, some people might be dismissive of it, but I see the hard evidence of how they work every day in practice.
So your response to that would be, well, okay, I understand that you think this is all, potentially hokum, um, but you've come to me, so let's give it a whirl.
Yeah, absolutely. I mean, it helps if people have got an open mind, obviously. But I certainly have helped all sorts of people from all ends of the spectrum, and people are generally very surprised and impressed when they see the results.
And do you feel that doctors have got a little bit more accepting, so rather than being negative about it?
Yeah, I think it's mixed. I work with a lot of lovely, very open-minded doctors who have heard from their own patients about the benefits of herbal medicine. And also, there are doctors who've actually seen the evidence. Look, for example, they might have done a scan with a patient 6 months ago and then they do another scan 6 months later after someone's been taking the herbal medicine and see something very different on
Mm,
that scan. So
mm,
they've actually seen it with their own eyes, the changes that can happen. Or they might see changes in blood tests, for example.
yeah.
So there's lots of proof, out there. But yeah, if doctors aren't familiar with any of that, you can sometimes get a bit of a negative response. And it's a real shame because in this country, doctors actually used to, up until the 1950s, it was actually part of their training to
Ah,
learn about botanical medicines.
mm,
Because up until that point, that had just been part of a doctor's training. They knew about these plants and how they worked. But that sort of all changed really with the advent of all these shiny new pharmaceutical drugs that were
mm,
introduced.
mm.
And now they don't learn about it anymore. So they don't have that training, they don't have that knowledge. And I think sometimes they just don't feel qualified to answer some of the questions their patients put to them, so they might feel a bit out of their depth.
So you're saying that you have women come with, let's say, breast cancer.
Mhm.
And do you work alongside their oncologists?
Yes, I often write to oncology teams and I will tell them what I'm prescribing their patients and I will work with the patient. My job a lot of the time is to help women stay on their medication and to work safely alongside the medication because often the medication side effects can be so brutal
Yeah, very brutal.
that they come off the drugs because they can't
Yeah,
stand it anymore.
I totally get that. Yeah. But like
So
actually,
if I,
I can't do the drugs. Mm.
yeah, so if I can help them stay on their cancer reducing drugs for longer, then and to work safely alongside that medication, then that's a win for the patient.
Mm. So do you feel this, do you work with mind, body, spirit alignment or not really? I mean, is part of it a kind of psychological component?
Oh, definitely. I think, especially with the work I do around menopause, I think it's so important because it's not just about the physiological changes that are going on in your system. It is a huge life transition.
Mm.
And it's almost like a shedding of the skin. It
Mm.
is a transformation that is taking place. Uh, and women go through an enormous mental, psycho-spiritual transformation at this time as well, where they make some pretty big changes in their lives and they really look at what's working for them, what's not working for
Mm.
them, what's serving them, what's not serving them, who do they want to be in their lives, what jobs do they want to be doing, are they going to keep saying yes to everybody and trying to help everybody, or do they actually need to take a step back and look after themselves for once in their lives? So, there's a huge amount of, I wouldn't exactly call it coaching work, but I definitely have some really deep and interesting conversations with my patients as they're going through menopause.
So it's not necessarily just the physical symptoms on whatever they may be. It's also about loss, isn't it? You're losing, I mean, basically, you're losing your fertility.
You're losing your fertility, and I think there's a huge conversation that we don't delve into so much, which is about aging and
Mm.
about the fact that we are not allowed to age as women. It's not okay. It's not all right. You have to keep striving to be 25 the whole time. And you have to try and look 25. You have to, have the body of a 25-year-old. It's not okay to get older, in our society. There is so, so much pressure on women. And I think that's what a lot of women really struggle with at that time, as well as um, a lot of other changes, big changes that are going on in their lives. But yeah, it can be a time of loss, but I think it can also be a time of great gain as well.
So it's a huge thing, isn't it? This whole thing about aging
Hmm.
and shame around aging or
Hmm. Hmm. Enormous,
and
enormous.
I imagine that herbs, natural medicines, can keep our bodies feeling healthy.
They can. They're very good at supporting balance in the body, and just bringing the body into alignment and correcting any imbalances. I always say that menopause is the perfect time for a reboot. It's the perfect time for you to take stock of what's your health doing? Where are you in your life?
Mm.
What how do you want to feel going forward? How do you want to feel going into your 50s and 60s? Do you want to feel healthy or do you want to keep carrying on with these same patterns that might not be serving you? Because, you know, women are not just menopausal women, you know, they come with so many other things going on. They might have lots of other health conditions that they want to sort out as well. They might, you know, they might have eating patterns they want to, you know, get on top of. They, you know, they might want to I mean, lots of women really start doing lots of exercise in their 50s
Yeah,
and
yeah,
just
yeah,
feel great, you know?
yeah. Yeah, I do a lot more exercise now than I used to, but that's because I didn't used to need to.
Yeah.
I mean, when you're young and you're just naturally fit and healthy, you don't need to go to the gym.
Yeah. Yeah, you know,
Right.
we have to look after ourselves so much more. And I think that's a huge life lesson that we don't get taught as young women.
Mm.
We don't get taught how to look after ourselves properly. You
Yeah,
know, we're always busy looking after everybody else.
yes. Yeah, I think that's absolutely right. That is women get to that stage of start thinking, what am I going to do now? Is there a difference between herbal medicines and homeopathy?
Yeah, there's a big difference.
Okay.
So, yeah, so homeopathy is a separate system of medicine that was developed, I think, in the 1800s. Don't quote me on that. Um, you know, and it uses extremely small, you know, micro doses of not only plants, but I think they also use minerals and other things
Okay.
in
Yeah.
homeopathy as well. And you know, it is a very separate system of medicine. So herbal medicine uses, you know, whole plants in, you know, a lot larger doses than you would use in
Mm,
homeopathy.
mm.
And you know, homeopathy has a system that they use, which is, you know, like cures like.
That's right. Yes, yes.
Yeah. But we, you know, we don't subscribe to that in herbal medicine. You know, we just are using the plants to support human health.
Okay, so someone comes to you and says, um, I've got hot flushes, I can't remember anything, I'm really angry, I'm perimenopausal, help me. Then what do? You then think, oh, what I feel that she needs is, then do you do a list of herbs that you think are helpful to support her?
Absolutely. Yeah. So after the consultation, I'll sit down and have a really good think and go through all the notes I've made. And I tend to just sort of write down like a whole list of herbs on a notepad.
Mm.
And then I just start the process of really honing that down so that when I make up the formulation, and this is a liquid formulation,
I've got my
yeah,
formulation. Right.
exactly.
Okay.
Very good. Um, you know, I'll be looking at putting together 6 or 7 different herbs, and these will be hitting lots of different targets all at once. So this is the beauty of making a herbal formulation, is that we can get a lot done. So I might be looking at herbs to support hormone balance. I might be looking at cooling herbs to help calm down those hot flushes. I
Mm,
might be looking at calming herbs to help bring down that anxiety. I might be giving some adrenal support, you know, something
mm,
like ashwagandha, for example, to really help with that adrenal system because so many women in menopause are sort of in semi burnout.
mm.
You know, there might also be some liver support or some gut health support. You know, it very much depends what the person's come to me with. But there'll be lots of things going on in that prescription.
Wow. And then you put it all together
Hmm.
and then you get it made up as a liquid, like as a liquid
Hmm.
essentially.
Hmm. Hmm. Yeah, so they're botanical extracts that I use, liquid botanical extracts.
Wow. And then you send it off, and then we get our beautiful herbal tinctures, our medicines. They're not tinctures, are they? Tinctures are slightly different.
No, they are tinctures. They are tinctures. Yeah, the medicines I work with are tinctures. So they are sort of high potency extracts of the plant chemicals, the plant constituents.
So what are your top 5 herbs, right? So one of mine, and I know this is really good, but one of mine is oregano, right? I think oregano is a herb that basically cures all ill as far as I can work out.
Hmm.
Sore throats, colds. In Greece, everyone's downing oregano like there's no tomorrow. Is that right? Is that not right?
Oregano is really effective. Definitely. It's a good one for colds and sore throats and things like that. You've got to be a bit careful with essential oil of oregano,
Very
because
strong.
if you take that internally, it's very, very strong and it can actually upset your microbiome because it's a
Yeah.
bit of a it's very antimicrobial, so it will kill
Right.
off a lot of your microbiome. But as a tea, it's definitely a wonderful antimicrobial herb.
What else is good for us? What should we all be taking every day? A woman of mind, I'm 58. I've come out of menopause. I mean, do we come out of
Yes.
menopause? But I think I am out of menopause.
Yeah, we do.
Yeah. So
We do. We come out the other side.
I've come out the other side. So what
Yeah.
should I take every day just to support my general health?
That is a very good question, Lucy. It's very difficult because everyone is so different, right?
Uh,
But I think if we talk about going into winter, for example,
yes. Yeah.
then obviously elderberry, which I've mentioned, is very, very helpful. Echinacea is a really good
Um,
one to take for your immune system to give you a bit of a boost through the winter. I really there's a class of herbs that are called adaptogens, and these herbs help us adapt to stress.
mm,
And, given the world we live in today and the stresses and strains of all of our lives, I really do think we should all be taking some kind of adaptogen. So that might be ashwagandha, which I know is hugely popular at the moment.
very popular, yeah.
Yeah, for good reason, because so many people really do need help with stress. Um, Rhodiola is another one. Holy basil is a good one
Oh, I
as
like holy
well.
basil just because I like the name. Yeah.
Yeah, and we've also got Siberian ginseng is another one, which is a good sort of all over tonic for our systems. So
Mm.
that class of adaptogens, I think, is extremely useful for most people, as we get through our busy lives.
Yeah. So the other thing my granny used to give me is a tonic. She would basically give me a tonic every week. I had a tablespoon of malt for bit B, I imagine, a tablespoon of cod liver oil, which was disgusting, and then she would bring out her tonic, and shove it down you.
And
Really?
do you know what was in it? No idea.
No idea what was in it. She would say it will keep you healthy, and you know what? It's interesting. Touch wood. I have been incredibly healthy.
There you go.
And my mother says it's because my granny just shoved this tonic down me every week.
There you go. I mean, there is a lot to be said for prevention is better than cure for sure.
Mhm.
And I mean, even just really, easily accessible things like nettles, just
Yes.
making a fresh nettle tea. That's full of iron and potassium and so many rich minerals in nettle, and all that chlorophyll. And it's
Mm.
just incredibly good for us, really good if you've got any sort of allergies as well.
Yeah, but
So,
you also need to get nettles that have not been sprayed. But the
hmm
issue I think is foraging in our countryside is quite often quite difficult because lots of
yeah,
has been on the sides of fields that's been sprayed
yeah, or
and
peed on by dogs.
or peed on. That isn't particularly what you want. So you need to go and kind of go out a little bit and forage a little bit in places that are relatively untreated.
Yeah, definitely.
So do you take? Do you treat yourself? Doctor, do you treat yourself?
Absolutely. Oh my goodness. I wouldn't be without my herbal medicine, my own personal herbal medicine prescription.
Mm, mm.
I really notice it if I haven't taken it for a couple of days. I really feel that menopausal anxiety sort of creeping in, and sometimes I can feel my mood kind of shifting a bit as well,
Mm.
and I think, oh gosh, I've really got to go and take my herbs. I forgot to take them today.
Mm.
Yeah, it really does help, and I mean, I'm about to turn 53. I've been through, or going through, been through perimenopause of,
Mm.
same as everyone else, I've had the hot flushes, the night sweats, the anxiety, heavy periods, all that sort of stuff that, I've just been really happy be to be able to have this knowledge to help myself through it all.
Mm. Yeah, it's fantastic. So, where can people find you if they want to talk to you and have a consultation with you and learn more about herbal medicines? Where can they find you?
They can get in touch with me through my website. So that's melindamcdougall.com, or I'm on Instagram, Melinda McDougall Herbalist.
Fantastic. And you go to lots of festivals, you do talks. I mean, you've got a lot of knowledge and information.
Yeah, there's lots of resources. I've recorded lots of webinars and podcasts, and there's also on my website, there is a free guide that you can download, which is all about using herbal medicine in menopause. So if you want to start learning for yourself and get a bit empowered as to what you can do for yourself, I'm very happy to kind of share all that knowledge.
Yeah, and I think you've been treating me for 4 years, 3 years. I mean,
Hmm.
bit of time.
Yeah.
And I have found it so helpful. So I just want everyone to know that Melinda's on this because she's an amazing person, but also because I can personally vouch for the work that she does, which I find so fascinating and helpful. So from all
Yeah.
of us that you've helped and all the people that you're going to help, thank you from the bottom of my heart for doing this work. It's very big.
Yeah, thank you. Yeah, I really find it so rewarding. I really do, and it makes me so happy when I see people really benefiting from the medicine and the work that, I've been doing. So I'm so glad it's helped you as well.
Yeah. Thank you so much.